Ramchandra sir is going to add his perspectives too to make it more useful. How am I qualified to talk? Like I said, I am a veteran of several exams. Leave the high school and college and all. I've done my MS, MBBS, MCH, 2 DNBs, a lot of non-academic exams too. I'm not talking about Hidni Prathama and Sanskrit Sura Saraswati Sabha. But just to give you a point, I've recently even enrolled for diploma, postgraduate diploma in National Law School of India University for medical ethics and law. Wanted to tell you that I've never failed in any paper in my life, and I topped most of my exams. My high point was that I was a university topper in first MBBS in Bangalore Medical College. I was second rank in MS General Surgery among 71 candidates. That time we had a lot of failure rates with the previous fellows. I managed to get the second rank. And in my MCH was a good point because by the time I was already married and there were 9 candidates appearing in my batch from various colleges. I told my wife right in the beginning, I said, I am going to top the university this time. She laughed at me. The way you're preparing for your exams, I'll be happy if you pass. But I said, don't worry, mark my words, and it pass. Why I'm saying this is, yes, it's not just a question of preparing, but also preparing hard. It's also a question of preparing smart. My ultimate highlight in my life was about anatomy part 2, in which I got 40 out of 40 in my anatomy theory paper, corrected by one of the strictest examiners, Dr. Vishwanath from Hubli. I remember after the exams, somehow he traced that I had written that paper. He called me and he told me openly that even I had written this paper, answered this paper, I couldn't have got more than 75%. And I went through your answer paper 4 times just to seek a single place where I can cut down the marks, and he said I could. Why I'm saying this, it's not a burst. The moral of the story is, if I can, anyone can, and yes, you can, definitely. It's just like the election machinery which our Amit Shah has done. Lots of things he has sat down and cracked it, and finally has made it like an election winning machinery. And the same thing can be done for your theory papers also, provided you practice well. That's the final message that I would like to give. The basics you have to understand. Why is it that there is a theory paper going on? It's always plagued me. I remember discussing with Dr. Sudipta Sen, who is Ramchandra sir's boss, about what is the purpose of theory paper, because most of the times the theory papers are evaluated in a hurry. Most of the times we don't fail the persons in theory paper unless they are really bad. And the papers are read fairly shallow during the evaluation process. So I asked him, why is it that we have to have a theory paper, sir? Why not just practicals and get away? His answer was thought-provoking. He simply said, Ramesh, this is the only way by which you are ensuring the candidate is reading from cover to cover. After this, for life, he is never going to read. So this is the only time we are ensuring that he is going to read. At least he needs to know where is what. There are a lot of advantages and disadvantages of theory paper. Advantage of a theory paper is that he is giving a theory paper. You can organize your answer. You can write at your pace. You can write at your leisure. You can reorganize yourself. You can camouflage what you know, what you don't know. You cannot counter argue at each level because you are completely, the interface is the newspaper, the writing paper that you have. So it is the biggest advantage. Unfortunately, the biggest disadvantage is also there, that you don't know their mood. You can't change your answer. You can't correct it. You can't strike it and write it back. And most important, however much I told you that they are going to read the paper superficially or skim through the papers, answer sheets, you don't know where their attention is going to grab. I've seen several times, trust me, I've been an examiner, theory paper evaluator also for at least 25 times in life. And most of the times you don't know what is being discussed by them, because suddenly some small thing they get highlighted and get. So that's the biggest disadvantage, that you don't know where they're going to get stuck. So it is better that you write all your answers well, in the hope that they are going to see. And it's bad luck that if you don't see it well, but anyway, it's your duty, your interest that you answer all your theory papers well. Generally, you have to understand the marking pattern is most of the examiners don't give less than 40% of marks for any answer, however bad it is, unless you have left it blank or unless you're completely way off the remark. We don't normally give less than 40%. Similarly, however well you have written the answer paper, we don't give more than 75% either. If you ask me, is it fair or right? I don't know. But who's bothered? We are right as examiners, and you as students are going to follow it. That's unfortunately the truth. So why I'm highlighting is, you have to make sure that you write enough. You don't need to write too much more, because even if you do a somersault, you will not get more than 75% mark. In short, basically you have to understand that you have to convey what you know. You have to convey to the examiner that you know the answer in a short way. It is a perception that you have to convey. That's the aim of your paper. Basically, in that you are not teaching him, and he is not going to learn from you. He is not looking out to pass you. You're not going to retain the paper for further reference. This is not an academic paper. This is not a research paper that is getting published for repeated reference. No, it's just that in that matter of 15 minutes or 20 minutes that he is going to read the paper. What you have read in written, taken pains to write in 34, 1 or 3 hours, he is going to read. So basically, you have to convey a perception that you know the answer. As I told, the psychology of the examiner, you have to understand. Both the examiners who write the paper, set the paper, as well as the person who is evaluating the paper, both of them are just as much human beings as you and me. Most of them are busy having other things, coming for theory. Most emphasis is given for practicals. The theory is not the primary aim, but it's just an additional thing. Each question paper is different and you have to adapt. It's not them, they have. Okay, so you have to make the best use of whatever question paper you have. Remember, it is up to you to cook what you're going to write and present in an easy manner for the examiner to assess. It is in your own interest. It is not his botheration to find out, search in an answer sheet what you have written. Like Professor Hande used to say, nurses paper, they used to write for symptoms for cardiac failure also the same, cardiac for something else as the same, peripheral vascular disease, they will write everything, dyspnea, headache, everything. You have to choose. Don't do that, because none of the examiners have patience when you are evaluating. They just look for cooked material, simple, straightforward, and conveyed. The pattern of the question paper is very variable, so you have to study the pattern and prepare. For example, many universities in West Bengal, Tamil Nadu, Kerala, they tend to have 2 long questions and 5 or 6 short notes. Some places they have only 1 long question. Many places they have only short notes. To the best of my knowledge, Rajiv Gandhi University has got only 10 short notes with equal marks. When you come to the question paper, question distribution, please understand 40% of the questions are fairly standard and unambiguous. No questions of controversies. That's how most of the papers are. That means describe the etiology of Hirschsprung's disease, or describe the neurological deficits what happen in a meningomyelocele. The questions are fairly straight and unambiguous. 20% are little higher questions. That means they may ask you about the steroid pathway in a what do you call CH, or they may talk to you about molecular basis or something. So it's a little higher question. 10% will be teasers most of the times. That is, they're little tough. That's not easy to analyze. For example, they may give a clinical case scenario. They may say there's a 4-month-old child with obstructive jaundice. How will you investigate? So you need to organize yourself. Or sometimes they may put some vague this thing saying what are the syndromic anomalies associated with Wilms tumor and indicate the implications of them. You know what I'm saying? There's a tag question to that. Remember that it's not surprising to find at least 10% of the questions to be surprising. For example, it may be something even the examiners may not exotically know. You may simply say role of robotic surgery in neonates. Who knows? There may be nothing. Even the examiner may not know, but you would give it. So don't be surprised. There will be a bunch and a mixture in all. There's again a variability amongst the examiners and paper setters. As I was telling the other day, setting a paper for DNB is far different from setting a paper for MSMCH. For DNB, they do ask not just the theory paper, they ask you to give a split up for each of the sub questions that you ask. They make the examiner, the paper setter, write an answer to this, and they get validated by a third party. That is, they send it to another person, say, is it all right or not? That much of patience is not done for everybody. The only place where I have seen Rajiv Gandhi University do this validation is for the theory paper for your entrance exams when they used to do earlier. So there are examiners who are sadists. There are some examiners who are dumb-witted. There are some examiners who are brilliant. There are some examiners who are going to be extremely pointed and clear about what they want. But you can't help it. You are at the receiving end. You have to handle everybody. All I'm telling is, be prepared that there can be any type of questions which come. This is the reason for which, when I gave you the theory papers, I made it a point to give you all elaborate questions, and all of them deliberately were long. This is not the way I set a paper. I am very clear in setting a paper where I am going to write, I am going to ask you, each one of them are defined, the answers are defined, and marks are defined so that you know how to organize your answer and you know where you are going to gain or lose. But not every paper is like that. Let me assure you that the university has got a huge question bank. I've given at least about 20 to 15, 20 question papers. I think Narendra has also given, Anand must have given, lots of people. And this time they have not asked me any question paper. So certainly they will be in the question bank from where they choose. They may even take it from other universities. So be ready for unexpected. Preparation for exams. Read all the chapters. Mainly because you don't know where the questions are going to come. And generally they come from the types which are not clinically you don't routinely see. For example, like you said, conjunctivitis may not be asked, or maybe orthopedic issue, or maybe something on vascular surgery may not really be expected that you routinely do read in your day-to-day practice, but may come up. You don't know. In general, remember that most of the examiners will have a priority to cover in the theory paper of non-vital chapters. That means which are not likely to be covered during the clinicals. For example, anorectal malformation, Hirschsprung's, tumors, okay, all these things are maybe biliary atresia. These are the things which are likely to be covered in your clinicals, and we're going to grill you enough. So, when it comes to theory paper, the emphasis may not be on this because we know for sure that we're going to be examining you on the theory and practicals and viva, that we may not cover in the theory paper, but we'll cover in things like recent advancements, molecular genetics and tissue engineering, all exotic things, only to kindle your interest. So make sure that you don't miss out, even if you don't emphasize to read, but remember. Another vital thing you have to remember is, please remember that even geniuses cannot remember everything. Am I audible? Just wanted to confirm.
Sir.
Hello?
Yes, sir.
Yes, sir.
Yeah, okay. So remember that even geniuses can't remember everything. So it's a common knowledge, it's a common thing, occurrence, that when you're preparing for the exams, you read everything today, spend a whole night. For example, like you said, Sridhar is studying all night out, and next day morning you remember, tries to recollect, you will not remember anything. It's natural. So don't feel depressed. If you can remember everything that you have read previous day, that means either you are lying or you are not read much. So don't get down and downcast, because nobody can remember everything that they read the previous day. Some common mental blocks. All of you must have recognized that the patterns of mistakes tend to persist. For example, you remember that one mistake you made after 1 week, you ask the same question, you tend to make the same mistake. After 2 weeks, again you tend to make the same mistake, because human brain has got a lot of synapses, and somewhere some synapses is wrongly formed. It is difficult to eradicate. If you recognize this, it will be great, because you realize that same mistakes are made again and again. All of you will recognize and understand. Okay, it's a human tendency, it's a brain tendency, it's a physiological, blaming it on physiology, not necessarily to take blame for yourself. The easy way to do is to link it to some emotional. I'll come back to this, how to break this later. Generally, for you to remember, link it to some emotion, auditory or visual memory, because just reading from visual by means of text may not be retained in the brain. But if you put it with an image, remember. If you put it with an auditory message, you'll remember. If you link it with a visual thing, you'll remember. If you link with an emotion, you'll remember. Simplest way, all of us see our favorite heroes' movies. Tell us how we remember even vividly the dialogues, the pictures, the background, everything. Are we even making an effort to remember? No way. Mind is like that, that if there is associated with emotion, somehow the right brain gets activated. And if you're going to have logic and this mixed, it's a combination of the left and the right brain, and you tend to remember it. So it is better that you tend to utilize your brain's pluses as well as the weaknesses the right way. Remember that some items are difficult to memorize. For example, if you want to remember the steroid pathway in CH, it's not easy. Our drug interactions for everything may not be that easy. So you have to accept the fact. Don't even memorize them. I'll tell you simple methods by which you can do it. And most common mistake why people do is they don't like always say, if you don't write what you don't know, it is not a crime. It's okay. But if you're not able to write what you know, it's a huge crime. And generally this happens because you get overwhelmed by the occasion. Countless instances are there about South Africa losing out, being chokers, Indians losing out in semi-finals and finals only because they made the extra effort. not ordinary extra efforts, but extraordinary extra efforts by which you tend to get overwhelmed by the occasion. Remember, it's a human mind that the significance of the event makes people commit unforced errors. That means whenever there's a major event, thinking about it. For example, I don't know how many of you remember when you proposed to your girlfriend, or when you first time met your girlfriend or a boyfriend. Tell me how things really went wrong. Okay, it happens normally because you tend to think, oh, what is going to happen, how it is going to happen. You're worried more about the future than the present. You're worried about what may happen. You may worried about the consequences that you may have. That the significance sort of pulls you down, and finally you get underwhelmed, like Ramchandra sir always says. In this context, you have to remember, like our good friend Mahendra Singh Dhoni. He was cool, calm, and he never committed unforced errors. In fact, he made the others do it. So it is not difficult, it's a cultivable habit. So a few tips about how to remember difficult things. I told you about the problems. Let us talk about the solution. What I'm saying is identify the pattern of mistakes. You know more than others where you tend to make the same mistakes again and again. Okay. The moment you identify it, so please recognize your weakness, because all of us are not equally endowed. Some people can do more in something. Some people can remember things. Some people can write well. Some people can remember well. Some people can associate clinically well. Whatever it is. So always it is good to identify the pattern of mistakes and keep a separate book. This is what I used to do. I used to keep a separate book in which I used to enter all oft repeated mistakes. So what happens is day in, morning, evening, night, just check it once. So that what happens, it's a repeated extra reminder in helping your mental synapses alter the synapses. Okay. So basically can keep a book in which you write your common mistakes and you write the solution there, and you don't need to make an extra effort. Just see that every time. Even if you're reminded, okay, this is the cue, this is how it is going to go. ये आ गया, ये trigger हो सकता है. So इसीलिए I'm going to think about it and I'm going to stop. So that is going to make a difference. So it may be worthwhile to keep a separate book in which you enter the repeated mistake patterns of mistakes that you get. Make it a point to discuss with your friends. All of you are lucky that you're not alone when you're writing your exams, unlike many of my students in the past. So what happens when you discuss with your friends, there is always a tagline remembered. So whenever you meeting in Venki or Jagu or Sridhar, just ask, "Arey yaar, ye terko ye malum hai kya?" You know something. Just in the passerby, because it's not a special effort that is being made. And you will remember either if you make the right answer or the wrong answer. Don't say, "I will read later." Commit something. Commit something. It asks, "Do you know what is the incidence of hypospadias with undesirable tests?" I'm just giving an example. Anything. So what happens, he says, you commit. You don't say, "I will verify and tell." You say, okay, it's 8%. Go and read it. Both of you will remember, because it may not be 8%. If it is 10%, you'll remember. If it is 8%, both of you will. So always discuss with your friends, especially about your repeated patterns of mistakes, because in the exams, you remember. Because I remember every time I used to make a combined study, in the exam hall, I used to have people waving from the other side as soon as they saw a question appearing, which we have discussed earlier. So it is good to discuss with your friends. Visual remembrance. As I told, just some things may be difficult to memorize, like I said about steroid pathway or something difficult. All you need to do is such cases, you identify which are difficult for you to memorize, write it on a piece of paper or take a photocopy, paste it on your door, paste it in your bathroom mirror, or keep it in a separate book where you don't make an extraordinary effort to remember it. Just see that morning, evening, night, twice, thrice. Keep seeing it again and again and again. Mentally, you would remember the pattern and your brain will remember the pattern. For example, it remembers the cyclopento, that ring on one side, and then you can write about, okay, 11 comes in the right top, 18 comes down. Even if you don't make an effort, at least by that you will be able to get it. So visual remembrance, utilize it well. Then, if you are good in writing, drawing, like I was good, so just write a diagram just for your appearance. What is, for example, if you say a question got faces, there's a lemon on matchstick. Just write a lemon in your style and write your two matchsticks. Then put stray. So what happens? They will remember it forever. So use your other things to your talents to see how best you can visually remember. Another thing always tell us, whenever you're reading, see if you can clinically correlate. You put it to a correlation about some case you have seen. I'm sure you must have seen lots of cases. So something comes about this tumor, just think, okay, in that case, maybe we missed doing this, or maybe we did this extra, maybe we shouldn't have done this, something. So the moment you link it to an actual patient, you'll remember it very, very long. Third, try to recall after 2 days. That is, you read today, just make it a point that whatever you made, like a small slip in which you're going to enter things, and after about a couple of days, just check how much you remember. you'll realize that you may not remember much. It is all right. But at least when you read more, the recall rate increases with every type that you're trying to recall. Always I say, again, an index reading is a good method to keep abreast. For example, sometimes you're bored of reading. Sometimes you just want to get out of the pattern of reading. So that's the time you're not in a mood to read the main text. Doesn't matter. You just look at you take up your textbook, take up index reading, take up the index page. There's something written, distal penile hypospadias or something, 5-alpha reductase, something, okay, or alpha fetoprotein. Something comes randomly, whatever catches your fancy, just recollect what all that must have been given in the textbook. Once do that, there's already a page number there. You don't need to make extra effort. Open that page and check what all you remember, what you don't remember. It's not difficult. Okay. So by which what happens, you will be covering hence back and forth and back and forth, and you'll tend to remember it better. So general tips about the final exams. Vandana and Ravneet will not agree with me when I say sleep well. Okay, let me tell you very clearly that I have gone for many exams without even having a wink in the night, and I've done well. But as I told, everybody's physiologic requirements are different. So it's better to sleep well and go. One. Number two, the more tired you are, more likely that you're going to make mistakes, more you tend to panic, more you think your what you call stress levels are more. So it is generally a very, very good idea to sleep well before the exam. Sleep well, relax. Yuddhakala Kshatravyasa, you're not going to achieve too much in the previous day. What you have not done over the last so many months, you're not going to get it in a matter of few hours, especially in a panic situation. You cannot. When you start getting bouncer, you can't go and practice for a bouncer. If you're not, it is going to be, if you're not prepared, you're not prepared. That's it. So relax. Trust in God if you believe. Because I believed in God. But there are people, if you don't trust in God, trust in the big scheme of things. Because this world or the big scheme or the God is not conspiring against you. It's helping you. It's just a tough phase in which you're going to go through it and you're going to come unscathed. Please remember, this exam is most important for you, not for others. After the exams are over, you're going to sit and laugh at it. Because when you're going through the exams, you would have been so much worried about it. And once the moment the exam is over, you realize, push, it's okay. If you believe in God, pray and unclutter your mind. Because generally what happens, mind is cluttered on the day of exams. Arey, kya hoga? I need to pass. I got to go to Warangal or Nellore or somewhere Tirupati. What will happen? If I fail, what will happen? My father is prepared. My sister has not got a job. Some this, that. Generally, you tend to get clutter in the mind. Don't do. Go with a clear mind. Unclutter the mind, because mind more cluttered it is, less likely to it is going to perform well. It's a mental game. So if you're going to be a mental game, it's better that you unclutter your mind, be clear in your think and go. Most important, don't think negative. Don't think negative. Okay? Because what you want to write generally comes out. I'm sure all of you will remember. So when you go and talk to somebody, you realize, okay, I know this, I don't know this, and you start thinking, I don't know. Generally, you blurt it out first. That's a human tendency. The best thing is, don't think negative, think positive. Think positive. Kya ho sakta hai? Then again, it depends on your mindset. Either you can say, like some people use affirmation taking, no, I am going to win, I am going to be hero. You can. Whereas some people don't want to think that way. They say it is a pseudo jumbo, mumbo jumbo. I don't want that. So in that case, you go the other way around. Okay, kya ho sakta hai? Okay, fail in the exams. Kya ho sakta hai? Ultimate is what? I am going to fail. If I fail, what is going to happen? Nobody is going to hang me. Nobody is going to kill me. I'm going to come after 6 months and take it. It depends on how you're going to look at it. Okay, whatever is going to empower you is what I wanted to do. But make sure that you don't think negative. On the day of exams, be positive, calm, and composed. Okay, it's easy to tell, but it is. I can assure you, for all the exams, whenever I've done very well, I've always been calm, cool, and composed. It is not difficult. It's not difficult. Just take it. Take blessings from parents and elderly, and most of all of you are married, so wish your wife well. Seek her wishes too. It's important. Put on your favorite dress and carry yourself well, because you need to be mentally feel happy and what do you call it, positive. Many of them do have sentiments. However, illogical it may say, if you have a sentiment of putting on a favorite shirt or putting on a favorite tie, please go. Even the great Sunil Gavaskar, even the great Sachin Tendulkar, even the famous Rahul Dravid had their own sentiments they followed. And nothing wrong, nothing wrong. It's okay. I'm not saying it is right. I'm only saying it is nothing wrong. Because if you have something, follow it. Because more than anything else, it will be sort of stuck in a corner of mind trying to say, no. So it's better to do it. If that is going to make you feel good, do it. It's after all you and your exams and not anybody else. And here you're not talking about rational thinking and trying to prove something to somebody. On the day of exams, remember that you are actually better informed than the examiner because you have read the textbook recently. Most of us have not even read the latest textbook in detail. Most of us, except some hardliners who don't have much time. Maybe they must have done it. But most of us, I do recognize that you are actually better informed than the examiner on the given topic. It's a psychological game, if not a warfare. Basically, you have to project what you know well and what you don't. Remember, it's like a war, like a quiver. Quiver means the container with all the arrows. You know what is there in the quiver, and you know what you don't have. Others don't know. So why expose yourself to say that I don't have this? What you have, use it well. What you don't have, cover it well. Others don't know, you know. So basically, work to the best of your advantage. If you look back at all spirituality that I have attended, whether it's Sri Ravi Shankar or whether you look at Sadhguru or Param Sivananda, Osho, Kalki Bhagavan, all of them say the same. Present moment is inevitable because you can't help it. It is there. No point in contesting it. No point in sitting and brooding about it. No, I should have studied. I could have done this. Why is the examiner so bad? Why is it that maybe this is said by A fellow, B fellow? No point in cribbing about it. It's all over. At the moment of reckoning is there. When you're sitting on the exam hall, the present moment is inevitable. Just take it. Better embrace it and wholeheartedly and go forward. Because not everyone is as fortunate as Arjuna. You don't get a Krishna Paramatma there in the exams. You just have to fight yourself without much guidance. Sometimes when actually writing the paper, mentally prepare for 10 minutes and calm yourself. Okay. So before the paper is given for 10 minutes, just shut your mind off, think quietly, close your eyes, attain nirvana, think about it, and say mentally say to yourself, I am going to do the best of my possibility because that's what is your aim. To do the best of what you can, not with relationship to anybody, not with relationship to some other day. It's like OD match. One wrong shot, you're gone. So make it, place it by the ball. Just prepare for that exams 10 minutes. Remind yourself of all the positivity that you can muster. Pray and surrender if you believe in God. And most important, once the question paper is given, read the question paper completely and do not be in a hurry to start. Take about 10 minutes, 5-10 minutes to analyze the question paper. As I told, there will be a mixture of all type of question papers. All type of question papers will be there, questions will be there. Some is going to paralyze you, some is going to empower you, some is going to get excited. So don't get overboard, don't get overexcited. Take about 10 minutes to organize your answer. Do not get excited or depressed by the questions because even the toughest questions that come may still find an answer. I'll give you a small instance what happened in my life. Okay, I think it's a pathology or some exams I don't remember in my MBBS level where one question was on Klatskin tumor, a short note. No way I knew what was Klatskin tumor then. I just did not know. So but I didn't get paralyzed. I said I'll write the rest of them and come back. And I finally came back. I started writing it very clear. I wrote what is Klatskin tumor? Extremely rare and very uncommon tumor. It can happen at any age, but it is common in elderly age. It can present in males or females, but predominance varies from region to region. It can presentation can be by either by the symptoms of the mass or it can be because of the compression on the adjacent structures it can cause. Investigations, imaging modality, ultrasound, CT, phenomena, treatment, if it is exercisable to exercise, otherwise chemotherapy, radiotherapy. None of them actually are truly applicable to the case, but finally I managed to get 50% of the marks for the question. So all I'm saying is, it's not a cheating, it's a question of being smart. So even the worst exams, worst questions can be answered if you're going to answer at the end. So choose the order of your order of answering questions. So first answer easier questions first to gain confidence. And again, a word of caution, do not go overboard. Something similar too well. So you choose in the beginning, you write too much of time, you take half an hour to write that answer, you're basically wasting your time. So do not go overboard. Keep the tough questions for the last because you can always, once your confidence is better, you can always think it out and you can write something. Make sure that you answer all the questions adequately long enough. As I told, you don't answer, you'll have to give 0. If you answer everything, you're obliged to give at least 30-40% marks. And as I told, in most of the exams, we don't give more than 75% marks for any given question. So that means If you answer all your questions brilliantly, you will get around 75 to 80%. If you averagely answer, you will get about 40, 50. So average is around 60% marks is expected most of the times, 60 to 70 based on how brilliant you are. Imagine if you leave out one or two questions, one question also, that question gets 0 marks because we can't give anything more than that because it may be cross-checked later. So no examiner would like to give any mark for an unattempted question. So such cases, what you tend to do is get 0. Once you get 0, your average comes down. And sometimes kind examiners like me, what I have done is I have revised the marks for others to make sure that you pass it. Don't get into that. So attempt all questions and not write about half a page and write it fairly well enough, at least fill up the page. Always remember that we got about 180 minutes per 100 marks. That means you take it for 150 minutes per 100 marks. That means you get 15 minutes for each question. Break that into 10 plus 5. That means for each question, no point in wasting more than 15 minutes. So keep a clock, click an alarm, keep a watch, whatever you want, whatever is allowed, device is allowed in the exam hall. Take about 10, don't, at the end of 10th minute, just reassess how much have you covered. It is likely that you must have covered 70%, 80%, 20%, I don't know. Based on that, the remaining time, you readjust. It's like an OD match. So asking grade, revise at the end of 10th minute, and whatever it is, you should finish in the next 5 minutes. You cannot drag on longer. We're given about 30-minute buffer for this, of which 10 minutes has already gone in the preparation. So we've got hardly about 20 minutes, of which 10 minutes may be for the final reorganizing the paper. So you may not really have too much of a buffer. Okay. So make sure that you're going to stick to your time. That is the most important. In fact, that is a lesson I try to convey by means giving your question papers which are actually tough. Please realize there is no extra marks given for lengthy answers. So you write for about 15 pages, you're not going to give you 15 marks for a 10 mark question. No way. You may still end up getting only 75 to 80%. As I told, work to your strength, because some people have got a good strength in handwriting, some people in organizing, some people in drawing, diagrams, whatever it is, work to your strength. This is where Ramchandra sir, I have to tell you about Ravi Shankar. In all exams, he was next batch. I was 85, he was 86 in all my MBBS. So every time I used to get more marks than him. So always he thought maybe it's because you are good in writing diagrams, that's why you get. I said, okay, try it out. Next exam, you took about 40 minutes to write one diagram and finally lost marks in the other things. So basically, you have to work to your strength. That's all I'm trying to tell. So more than anything else, you know what is right or wrong. And as I told, is an answer script is a question of about 15-minute evaluation of what you read over 3 years, what you extra given for the last few months, and what you take 3 hours to write. So it's going to be only 15 minutes. Don't talk about fairness and unfairness. That's what it is. So you have to do every effort to grab their attention, to let them know that you know. How to grab attention? Organize each answer mentally before you start writing. I've been telling this again repeatedly. So once the question is written, mentally think about what are the headings under which you're going to write, what are the points you're going to highlight, what are the points you're not going to highlight. Okay. Be clear about what you wish to write. Answer to the points that has been asked. So you don't need to write more than what is needed. For example, if they're talking about etiology of Hirschsprung's, you don't need to write the history of Hirschsprung's. You don't need to say that Donald Hirschsprung is a Danish pediatrician who in 1804 identified. Not needed. Not needed. So come to the point about what exactly they've asked. Be clear about what you wish to write. And again, as I told you, you don't need to write everything that you know. You don't need to. And this is not possible. So just write what is to the point and don't write more. Don't write unnecessarily. Handwriting. As I told, handwriting need not be as great as Ram sir. So even my handwriting is not great, but it's definitely legible as compared. So I will be as effective as Ramchandra sir. But if you have a great handwriting, it's lovely. So please use it. But if you don't have, it's too late for you to change. So please remember that your purpose of handwriting is to convey to people that you know, not necessarily to impress them. But make sure that you write as legible as possible. Use only standard abbreviations. For example, ARM is accepted. HPS is what you write for hypospadias is not acceptable because that's not universal. Okay. So don't write a COCO. All those things are not, because it varies from center to center. Better not to write because it will be at your disadvantage. Like a common saying goes, SOB for somebody is shortness of breath, but somebody else is a son of a bitch. Not all right. Most important, do not use SMS or WhatsApp shortcuts. I've seen this many times in theory papers when people write because you've been texting in this thing, you say lol and this thing and for, and it irritates. It definitely irritates all examiners. So do not use shortcuts, which is the jargon in SMS or WhatsApp. Please take. Always remember, to serve cooked food. That is, your job is to present the material and present well, nothing more. Remember, in an answer paper, it's both matters, that is substance and style, just as in life. Unless you have substance, you cannot have style. But if you have only substance and no style, not possible. Only style and no substance will fail. So make sure that you have gained your substance all these years, and now presentation is only about a question of style. How well you present is what is going to determine how well you're going to score. Some more tips to grab attention. Always illustrate your answers well. You don't need to be an artist to write it. Like I was telling about my friend, you don't need to try what is not your strength. If you're not good in drawing, it's okay. Try to think of simple line diagrams. For example, both the line diagrams that are seen here, you can make out that conveys everything. No point in spending 25 minutes and try to get a great smiley. He conveys everything, simple line diagram. Label the diagram well, because what you think to be a kidney may be hard to somebody else. It is not all right. So it is okay. We are not checking your artistic skills, but make sure that you label your diagram. Add a box if possible. I'll show you about the box later. Don't waste too much time on that. Just make sure that you're going to add. Once you put a diagram, avoid repetition of the text, because I've seen this very many times. You put a diagram in which you put, and then you start explaining the diagram. Not needed. You put a diagram, that means that you have understood it and you put it there. You don't need to necessarily go back and try to explain the diagram all over again. It is not a presentation. Similarly, you can use a flow chart which is clear and neat. So I just said, just think about it. You can even come out with something which is very innovative. For example, when you say approach to a child with say obstructive jaundice, you can say evaluation, clinical evaluation is one. For example, you're going to say a jaundice side, 4 months, evaluate. If liver is this, if liver is that, the liver function test. What I'm saying is that generally conveys, whenever you put a good neat flow diagram, neat flow chart, it means that you have analyzed and understood it well, and I think you conveyed it very well. How to grab attention? As I told, as you write the text, see if you can underline the headings and keywords, because this is the one which is going to stand out when you're evaluating the paper. So write, underline, make sure that as I keep on, I think all of you know about my insistence on keywords. Everything has got certain keywords, every answer. Make sure that you're going to underline them. When you're underlining, please use either a black or a blue pencil, that is pen. That is, if you're writing a blue, you can write with underline with black, or if you're using a black pen, underline with blue. If you think it is difficult, use a pencil. Never use a red or green color, because red color is for the evaluator and green color is for second evaluation. Of course, now that it is online, it may not be relevant, but it's always good to remember not to use red or green because it's jarring. Don't think that you're going to come back later and underline. You may not have time, you may not have known what is important to be highlighted. So what I've always suggested is keep a scale, a ruler, and keep a pencil or something right then and there. As soon as you write, highlight it then and there. Okay, don't come back again. Underline whatever keywords or key things that you want to highlight, just underline. Even if you think it's going to be cumbersome using a pencil, underline with the same pen that you are writing. It's not a problem. Okay. Place your diagram well. For example, this will catch your attention because it's on the outer side and in the top in the beginning itself. Whereas this is on the left side. On the right side, it is going to be on the outer side because it will grab your attention. Because you don't want them to read your textbook rather than to see your illustration. Whereas if it is hidden inside, it may not be that well seen. These are the tips and tricks which I was taught to me by my teacher H.S. Nagaraj, who actually is a founder member of is a founder of BASE. In fact, I've fine-tuned from what he has told me and to come here. So just generally, even placing the illustration in the beginning and on the outer side of the paper always makes it a better thing. As I told you, just make a square box so that it makes it looks better. Just like a textbook, now when you're reading a book or a journal, I mean, if it is printed well with good fonts and well illustrated, you feel happy to read it. So just make sure it can be done. A few last words, don't worry. Too much of jargon gone so far. Few general words is prepare well, don't lose confidence. Don't panic, relax. Measure twice, cut once. That means read, think twice before write, because once you write, you can't scratch it, you can't not come back. Presentation is as important as the content. You have the content also, but of course, if you don't have content, only presentation will not help. But presentation is as important as the content. Or answer all the questions with sufficient readings and long enough to award some marks. Remember, the recent, to the best of my knowledge, in the recent years, they don't give extra sheets because that used to lead to a lot of malpractice earlier. Because people used to add answers, supplementary sheets later for malpractice. they stopped it. That means if they give a paper of 36 sheets or something, that is it. You cannot add. Sridhar, particularly, you have a tendency to be environment unfriendly and using a lot of paper. So organize your thoughts well, organize your
Yes, sir.
thoughts well, and write,
Yes,
because
sir.
you will not
Yes,
be
sir.
given extra sheets. Okay.
Yes, sir.
When I actually gave last quotation, I would like to say, when I was actually, I was very keen on doing general surgery. I couldn't get a general surgery MS in the beginning, so I got a DNB. I was thinking of joining. I got it in St. John's, sir. So that is the time when I went and said DNB is difficult to answer. This is a famous quotation given by somebody then. Any test or examination designed by a man, however difficult, will certainly be conquered by another man. Any guesses who told? This is my Krishna Paramatma in life. Srimurti. Okay. Best wishes. It is for you to go and conquer. Remember, yes, you can. Thank you very much, all of you. And I would be happy if Ramchandra sir adds a few of his comments or as many as possible. And then, in case you want anybody else wants to discuss, I'll be more.
That was a brilliant presentation, Ramesh. I really loved it.
Thank
Genuinely enjoyable presentation, and you have conveyed absolutely what is really required, spot on for the exam going students. It was wonderful. Thank
Thank you
you
very
very
much, sir.
much.
Thank you very much, sir. Really appreciate it.
Just
Thank
just
you.
few points I want to tell.
Please, sir. Please, sir.
No, just
Please.
few points. When you
Please.
want to carry anything to the exam, remember about the writing material. Take the pen you are most comfortable with. These are small things. What you have
Correct.
always written with, the pen which you love, take that pen. Most of us have that habit of using that pen. So take that pen, keep it as the primary pen for writing the exam because you are most comfortable with it. Don't buy a new pen for the sake of exam. It may not work at the time of the exam. Take one or two additional pens, and as Ramesh said, take some pencil or something to draw some diagrams, and then you can highlight it with the pen later and use a scale to underline your important points. Other thing I found is the crucial, uh, what you could call the crucial point in any exam is the first day, first question. If you have taken enough time to answer the first day, first question confidently, make sure you do that. If you do that and you are not flustered when you do it, you have done it calmly and quietly. That's the only thing. Keep that in mind. The first day, the first question. If you do it properly, everything will flow to you. So don't worry about anything. Just concentrate on answering the first day, first question, first question from the question paper correctly, and then everything will flow to you. As all of us know, we are all well read. We have prepared well for the exam. Unless you have not opened the book at all or not opened the covers at all, which is very, very unlikely. So I think um, you just have to organize yourself in such a way that, because as Ramesh said, it's basically a psychological game. So make sure that you just do the first day well. Everything else will flow. You will find that it's very easy to face the exam after the first day you have faced the exams. Then it becomes sort of, you'll be looking forward to when is the next day. Suppose you have gaps, you'll be sad that there is a gap between the two exams. You want to go, and you are so enthusiastic to write the exam. So that's what happens. The good hormones will flow, like we say, dopamine will start flowing, and you feel good about yourself. And uh, f- concentrate on, as Ramesh said, concentrate on being present at the exam, um, the exam room, being present there completely, totally. If you concentrate on that and do the first day properly, you will crack the exam without any problem. And you are all great guys at cracking exams. We don't need to tell you. We are just reiterating what you have done before.
Thank you very much, sir. Now, just to add to what Ramchandra is saying, when it comes to stationery, get your favorite pen, keep additional pens, see what it is, because a lot of us do have these small little fixations. For example, I don't like a pen which is sort of leaking. I don't like thick writing. I want thin writing. I don't want to ink overflow. But somebody may like the other way around. So find out, check all your pens, have at least 3 or 4 pens with you. Choose with the best pen that you want. Keep all your pencils, erasers sharpened and keep it ready. So don't wait long. Okay. take a instrument box, keep all of them ready and handy available. Like first day, first show, what Ramcharan is saying, sir, this is exactly what I do for all our conference and workshops. You know it well. Like Shrimurthy sir says, it's a chariot. The toughest thing is to get the chariot pushing in the first teru. Once the teru starts, it will run on its own tempo. You don't need to do anything. So just make sure that it is there. Another crucial thing I wanted to tell you was don't repent for something you have missed out. That's another common mistake which people make. That is, you know something and you have not written well, and come back and you say, no, I should have written. I should have. Don't lose. It's okay. It's gone. One ball, one wrong stroke, and you missed out. It's okay. Go ahead next. All right. Any other? Yeah, please. Anybody else? Please.
Sir, Anil here.
Yeah, tell me, Anil.
Sir, you have summarized very well. It's very crisp and clear.
Yes, sir.
In fact, they can take a printout and keep it on their study table. So the points are so clear. So when
Thank
you
you,
are some of the points were running in my mind so that I can tell, but most of the points you have covered. As
Okay.
Ramesh said, no, sir, it's the same thinking. So think less at the last moment. So whatever will happen, will happen. So thinking at the last moment will only decrease your performance. It is like just riding a bike, sir. Like you start a bike, go gear by gear and go fast. If you start and if you put a last gear at the first moment, you're going to triple. So the same point, sir. Think less. Already you have prepared. Start slow and go fast later. So this is my advice. And other thing is remember technique. Always I tell my juniors is whatever you know, you try to tell to others. Don't think that they are going to remember or they're going to take more marks just because you have told. If they tell to others, then only they can remember. Otherwise, they'll forget. So always share your knowledge so that you can remember better. Thank you, sir.
Thank you, Anil. Anil was spot on. In fact, my biggest strength at every level, I remember for exams or whether MS, MCH, wherever, was in the process of trying to share more to others. I used to tell to everybody whatever I knew. So that what happens finally, you also remember, they also remember it better. So it is good. Just to let you guys, Anil is one of the best students I know, outgoing students of Indira Gandhi. I think was one of the last few DNB candidates. He's doing extraordinarily well. He's very, very level-headed. Thank you, Anil. All your points are very valid. Thank you. The exam going follows.
Sir. Yes, sir.
Anything?
Nothing major, sir. I think it boosted our confidence, and I think we will do better.
Okay. Sridhar and Venki?
Sir.
Yes, sir. Yes, sir. Hello.
Yeah, Sridhar and Venki.
Yes, sir.
No questions.
Sir,
Sridhar has some questions, sir.
Yeah,
No questions, sir. Just we have
Sridhar's
confidence. We
Google
will try
share.
our
He has only answers.
no. We will try our best in the exam, sir. One thing I should not get nervous. We will try our best, sir. Really sure.
Okay.
Yes, sir.
Yes,
Yes,
sir.
Jago,
Thank you, sir.
do our best,
Yes, sir.
and world is there to
Yes,
conquer.
sir.
Please go and conquer. Okay. Best of luck, and thank you very much for everybody.
One point I want to tell Ramesh.
Yes, sir. Please.
Just on the funny aspect.
Yes, sir.
Just remember who's that godman who comes frequently jokes about him? I forget his name. Nityananda, is it?
Nityananda.
Yes, sir.
Okay, okay.
Yes, sir.
So Nityananda, remember in exam, it is me talking to me and me writing for me. Okay, remember that. Me
Yes, sir.
talking to me, thinking about me and writing for me to make me pass in my exam. Okay, remember that.
Yes.
Nice one, sir. It's a
Yeah,
selfie message for the day.
yeah.
Atmanirbhar.
Thank you, sir.
Atmanirbhar.
Atmanirbharata.
Yes, sir.
Thank you, guys. This note. Yeah, tell me. We are meeting again at 10:30, is it?
Sir, Vandana here. Sir.
Yeah, tell me, Vandana.
Sir, for our MS exams in RGHS, we were allowed to write only in black ball pen and not use either pencil or blue color because
Okay.
it was online scan and correction. So,
Okay, maybe. Thank you very much for highlighting. Please so verify if that is the case. Please comply to that. In that case, for
Sir.
underlining, use the same black pen.
Yes, sir.
Yes, sir. Sir, this is Jagdish. Sir,
Yeah.
actually, that is the point which I want to tell in
Okay.
between where I interrupted. They actually even MD exams they have written in black pen only, no pencil, no other colors, nothing. Only one
Yeah.
pen that is black. Throughout the
Agreed.
paper, you need to write with that one. You need to draw with that one.
Agreed. But again, I would like to. I mean, so go stick to that, no problem. But again,
Yes, sir.
see, MCH exam still last year was not a digital evaluation. Okay, broad specialties were a digital evaluation, and broad super specialties we have done physical correction. But maybe they may introduce this time, so it is better to adapt to that. I got your point. Very well taken. So, right, use only black ballpoint pen and underline black only.
Yes, sir.
Yes, yes, sir. Thank
Then
you,
another
sir.
comment. We'll wind up. Hope it is useful.
Yes, sir.
Thank you. Thank you very much.